Perioperative nursing is a field in which nurses assist in the operating room during surgery. These particular nurses specialize in three different stages of surgery: 1. Preoperative stage, 2. Intraoperative stage, and 3. Postoperative stage. These stages include tasks such as performing tests, monitoring, and preparation for surgery so surgery may begin, and extended care after surgery.
The first evidence of surgery goes back to the Stone Age, but surgery became more advanced in the 19th century. During this time, anesthetics were discovered, and this enabled surgeons to perform many more complicated operations. The surgeon's hands and clothes began to be sterilized before the operation, and surgical instruments were sterilized with superheated steam. Rubber gloves were first used in surgery in 1890. In 1883, Robert Lawson Tate removed the fallopian tube of a woman suffering an ectopic pregnancy to save her life. The first heart transplant was performed in 1967, and the first lung transplant was performed in 1987. Surgery in the 20th century has made greater advances that included brain and heart surgery. Today, surgery has become more advanced, and with the help of technology, surgery is only going to become more productive than it is now, and can change many people's lives.
There are 3 different phases of nursing care, which are pre, intra, and post-operative phases. Depending on each phase, the operative nurses take different responsibilities and patient needs. The goal of the preoperative phase is helping patients mentally and physically prepare for surgery. In this phase, the nurses check the nutrition intakes, educate, and take care of the patients until the patient is transferred to the operating table. One of the first steps of this process that the nurse is responsible for is to help guide the patient to fill out the surgery consent form. In the intraoperative phase, the nurse's highest priority is safety, and 2 different intraoperative nurses become a part of the surgical team. These include circulating nurses and scrub nurses. The circulating nurses' duties begin prior to the patient's arrival. They check patient information and doctor's orders. They are also in charge of keeping precise documentation, such as intraoperative charting, techniques, and procedures. They provide anesthesia and reverse when needed. They serve as a communication between other departments since they are the non-scrub members of the surgical team. In addition, they help the patient alleviate the nervousness and provide psychological needs. The scrub nurses set up the instruments and ensure that they are sterilized. During the surgery, they count and provide the instruments and inform the surgeon of all information. During the postoperative phase, the nurses are in charge of promoting the healing process, providing comfort, and preventing associated risks after the surgery. They closely check the patient's condition and report back to the physician, and also document vital signs.
Because the medical surgical nurses closely interact with patients who are extremely nervous and work under the tense environment, various skills are required. For example, in order to be aware of the changes and understand the patients, they need to have social perceptiveness and become an active listener and learner. Persuasive skills are also needed to change the patient's mind and behavior. The surgery is performed as a team. As a result, the nurses are required to be cooperative and be familiar with working as a team. In order to deal with an unexpected situation during the operation, they need to be able to think critically and need good judgment. System analysis and evaluation, monitoring, and time management are also significant skills for the patient's safety during the surgery.
As a perioperative nurse, he or she provides behavior and scientific practices in order to meet the patient's needs. It is crucial that the nurse evaluates psychological and physiological conditions of patients before, during, and after the procedure. In addition, they must have thorough knowledge regarding an aseptic method and patient security. During the preoperative stage, the nurse is responsible for preparing everything in the procedure room, providing supervision for the transferring and moving of the patient, performing as an advocate by keeping the patients from illegal, unprincipled,
or ineffectual practices and correct or proper positioning of the patient. During the intraoperative stage, the nurse is responsible for keeping precise documentation during the procedure, providing and reversing anesthesia, and maintaining a safe environment. During the postoperative stage, the nurse is responsible for communicating urgent needs to the right individuals. Ultimately, the perioperative nurse is to provide excellent care throughout the surgical process.
These registered nurses work in surgical departments, physician offices, and clinics. To qualify for perioperative nursing, one needs to qualify as a registered nurse by successfully completing a Bachelor's of Science degree in nursing. Career opportunities for perioperative nurses are almost endless. These registered nurses can become operating room directors, and with additional education, they can become nurse anesthetics. A nurse anesthetic provides anesthesia for patients undergoing surgery. Employment for perioperative nurses are expected to increase through 2010.